But we start this morning with the U.S. on the brink of yet another COVID surge.
This time with two variants, Delta and Omicron. An average of 120,000 Americans are now testing positive for COVID each day. That's a 40% increase in cases from just 2 weeks ago. Now the CDC is making some ominous predictions, including a massive spike in new infections by the end of Christmas week, predicting up to a 55% increase. That would be 1.3 million new cases in just 7 days. The number of people dying day to day could shoot up 71%. The CDC says well over 15,000 people could die in a single week. Now, as cases go up, the lines for COVID testing are looking a lot like they did in 2020, getting longer and longer. I know I saw it firsthand walking home yesterday. The demand for testing is skyrocketing, and it is getting harder for people to get their hands on those at-home tests.
Health experts still say our best weapon in this fight is the vaccine. And now the CDC is telling people who still aren't vaccinated or boosted to avoid getting the Johnson & Johnson vaccine over those blood clot concerns. NBC News medical contributor Dr. Uche Blackstock is here to break down what that means for people who did get Johnson & Johnson. But first, let's go to MSNBC anchor Lindsay Reiser in New York City and NBC News medical reporter Erica Edwards with what we know right now about this spike in cases. Lindsay, good morning. We'll start with you out on the streets of New York City. So the COVID positivity rate here has doubled from last week alone. What are city officials saying about this increase? Are they worried they could see a surge months after, we fully reopened, New York City was back?
Joe and Savannah, good morning. We're talking about an increase in demand in testing. Look no further than this City MD here on 57th Street. This place is supposed to open right around now. People have been lined up for a very long time. The line now stretches down the block all the way to the stoplight on the other side of the street. And we're seeing people wanting to wait in line because they're traveling. They want to see family. Some people have been told that somebody they know was exposed. Other people believe it's their civic duty. But we're talking about the alarming rise in cases, right? You mentioned the city's positivity rate doubling week over week to 7.3%. The numbers lag a little bit. So that number was as of Sunday. It could be different now. But also, the governor of New York tweeted an alarming statistic, too, about 18,276 cases. She tweeted that yesterday for Wednesday's total. That's the highest total since January, since the winter surge. And it's also a 40% jump in 1 day. And so when we talk about the Omicron variant and Delta, we know Delta is still predominant here. But take a look here at the numbers for Omicron, because the CDC says New Jersey and New York are seeing rates at 4 times the national average. So we're talking about 13.1% of positive cases are Omicron, compared to the U.S. average of 2.9%. The governor is calling this a public health crisis. She says right now that now is the time, of course, to get boosted. Let's also listen to the city's health commissioner about the alarming trend that we're seeing.
Unvaccinated New Yorkers are 8 times more likely to have a COVID-19 infection, and they're 13 times more likely to be hospitalized with COVID-19. If we use the tools that we have, we will be able to turn the corner on the pandemic. Booster doses are a near-term focus for us.
Now, the incoming mayor of New York City, Eric Adams, says it's going to take a lot for him to lock down the city again. We're not at that point yet, but he is not taking off the table the possibility of using Javits as a field hospital again, Joe and Savannah.
So, Erica, beyond New York, the uptick in cases is also on the minds of top health officials working with the White House. What are they expecting over the next few weeks?
Yeah, good morning. Well, really nationwide, officials are bracing for exactly what Lindsay was just talking about, a convergence of 2 highly transmissible variants, Omicron and Delta. Delta, of course, is continuing to lead to a surge in cases, hospitalizations, and sadly, even deaths around the country. Now, yesterday, Dr. Fauci told NBC News that he fully expects things will get worse as we enter the depth of the winter, especially with those fast-moving Omicron cases. He and other public health officials briefed President Biden on the situation yesterday. Afterward, the president reiterated that vaccination is key. Here's what he had to say.
The whole point is Omicron is here. It's going to start to spread much more rapidly at the beginning of the year. And the only real protection is to get your shots. If you get 1 shot, if you haven't gotten it yet, that'll help. If you're at the point where you have everything, including your booster, you're in really good shape.
Now, everyone ages 16 and over is eligible for that booster shot. Joe?
Now, Lindsay, we just saw that line at the City MD that you're at, and as Joe said, he saw it on the way home. I've been seeing it all over the city. It's not just the location you're at. I've also been hearing that getting those rapid at-home tests from any type of pharmacy in the city is getting tough. Many of them don't have them. What is the city doing to try to make sure everyone has access to a test as we head into Christmas next week and we're seeing this surge?
So the city says they're going to be giving out 500,000 rapid at-home testing kits and 1 million K95 masks. They're going to be giving those out to community organizations. They're also going to be expanding hours at fixed city testing sites and adding more mobile sites. And while the people I talked to in line, they weren't bothered. They said, look, I'm glad people are getting tested. This is what we have to do. I did talk to Dr. Uche Blackstock last night, who I know you're going to be speaking with just shortly. And I asked her, what do you think about these lines? And she agreed that it was crazy that at this point in the pandemic, we are still seeing lines like this. So definitely some people are calling for more action, Savannah.
And Erica, hospitalizations are starting to slowly tick back up. A lot of hospitals around the country are dealing with staffing shortages. What are some of the ways hospitals are trying to make sure they're prepared for a potential influx of patients?
Yeah, so there are some major hospital systems, Cleveland Clinic, Intermountain Healthcare in Utah, that are actually dropping their vaccine mandates for staff in order to keep as many of those staff members as they can, especially nurses. I think any doctor worth her salt will tell you that it's really the nurses who do the bulk of the heavy lifting in hospitals. Some healthcare systems have actually turned to nursing schools to try to train as many nurses as quickly as they can. And one official at Jackson Memorial Health in Miami actually said that they're reaching out to hire nurses even before they get their licenses. Joe, Savannah.
All right, Erica and Lindsay, thanks so much. Appreciate your reporting.
Overseas, the Omicron variant is driving yet another wave of COVID. The UK is seeing its highest number of cases ever, nearly 2 years into the pandemic. Now, nations across the continent are racing to vaccinate and boost their residents, and in some cases, reimpose lockdowns. NBC News foreign correspondent Matt Bradley, has the latest from London.
In a sign of what could be to come in the U.S., countries across Europe are scrambling to deal with a crushing wave of COVID, now compounded by the highly contagious Omicron variant.
No one should be in any doubt. There is a tidal wave of Omicron coming.
The UK shattering its daily case record, nearly 90,000 new infections reported just today. Health officials racing to get all adults boosted by the end of December.
We're not closing things down. We're not asking people to cancel things. The sensible thing to do is to get boosted now and exercise caution.
Germany pushing boosters too, but warning there's not enough supply. Now negotiating with neighboring countries to secure third doses for more than 50 million people. In France, ICUs again overwhelmed, this time with mostly unvaccinated patients. Nurses there exhausted. We want to call on people to get vaccinated, she says, to help the patients here who are immunocompromised, who get vaccinated, who respected all the rules. With 1/3 of Europe still not vaccinated, more countries are moving to reimpose strict COVID measures. Denmark this week returning to remote learning, also closing bars, restaurants, and nightclubs. In the Czech Republic, officials banning Christmas markets and the drinking of alcohol in public as part of a 30-day state of emergency. In Italy, all unvaccinated visitors are again required to quarantine upon arrival. And in Austria, all adults will be required to get the vaccine, beginning in February. Those measures prompting demonstrations across the continent. Tens of thousands marching in protest of lockdowns and vaccine mandates, at times turning violent. But with just 60% of Americans fully vaccinated and less than a third of those people boosted, health officials in the U.S. are already sounding the alarm.
I think we're already seeing a really terrible wave in real time. We're just sort of numb to the figures at this point. So I think that lag time between what Europe used to experience and then us experiencing it a few weeks later, I think that's been erased entirely. And we're still dealing with dual threats right now.
And that was Matt Bradley with that report. Thank you, Matt.
NBC News medical contributor Dr. Uche Blackstock joins us now. So, doctor, given what we're seeing here and around the world, what do you think the next few weeks hold for us? And what's your advice to people now this holiday season?
Thanks so much for having me on, Joe. I think we need to brace for probably what we may see as the worst of the pandemic so far, with two highly transmissible variants, with waning immunity, with people spending more time indoors, and the fact that we have a significant minority of people who are unvaccinated. We probably are going to see an explosion in cases. And so that's why it's even more imperative for folks to follow those mitigation measures that we know work so well and that are the foundation of public health: high quality masking, getting tested, but we see that the testing capabilities are not up to snuff. So they have to do their best with testing and, physically distancing and keeping your gatherings small with vaccinated people.
Let's talk about one particular vaccine, that's Johnson & Johnson. The CDC now telling people get Pfizer or Moderna because of the risk of a rare but potentially life-threatening blood clot if you can get those. So if you did get J&J or got the J&J booster, what should those folks know about this? How concerned should they be?
Yeah, I would say for people who have received Johnson & Johnson already and they're more than 2 weeks out, there's very, very little concern. This side effect was seen within the first 9 days after the shot. It still is quite rare. It's mostly seen in women in their 30s to 40s. And so, again, if you've gotten the Johnson & Johnson more than 2 weeks out, you shouldn't be alarmed. If you're less than 2 weeks, look out for symptoms like headache, change in vision, and anything else that seems out of the ordinary.
So, Doctor, do you still have a strong level of protection against Omicron if you did get J&J? I know we're still learning a lot about the Omicron variant, but what do we know about that variant when it comes to J&J?
Right. So there are some lab studies. We don't have clinical data, real life data yet. We have some lab studies that show that the Johnson & Johnson vaccine may indeed be less effective against Omicron than the mRNA vaccines, which is one reason why the CDC encourages this mixing and matching. And we're seeing with mixing and matching, if you follow the Johnson & Johnson with an mRNA vaccine, you have a more robust immune response, greater effectiveness against coronavirus, including the variants as well.
All right, Dr. Uche Blackstock, as always, thanks for answering our questions. We appreciate it.
And we'll have more COVID coverage throughout the show. But now to the latest in the trial of former Minnesota police officer Kim Potter. The prosecution wrapped up its arguments yesterday, and now the focus turns to Kim Potter's defense team. The former police officer agreed to testify in her own defense, and we could see that happen sometime this morning. NBC News correspondent Shaq Brewster joins us now from outside the Hennepin County Courthouse. Shaq, good morning. So walk us through what we could expect to hear from Kim Potter herself this morning and what her defense team will try and prove to the jury today.
Well, we expect to hear Kim Potter testify that the use of a gun was a mistake, but that the use of force by an officer was necessary because, in the words of her defense team, they couldn't let 20-year-old Dante Wright get away. And that's what we expect to hear from Kim Potter after what has been a day of testimony from the defense where they really tried to poke holes in the case that was laid out by the prosecution. Remember, the prosecution is arguing that even if Kim Potter intended to use her taser, that was still an excessive use of force, and that wasn't justifiable. But the defense has been putting on witnesses saying that her use of force was appropriate, and that even if she intended to use a gun, that was necessary and that was appropriate because of the chaotic situation that existed. So we'll expect to hear from Kim Potter in her own words today. We know that she's been emotional throughout the trial. She was emotional in the direct aftermath of the shooting. So we can expect to see some emotion from her when she takes the stand today.
And Shaq, you just referenced some of this, these other witnesses we heard from. Some of those people happen to be Potter's former boss and two use of force experts. Yeah. Tell us some of the highlights from those testimonies.
Well, you heard the use of force experts say that she did not violate policy or the law when she shot Dante Wright, and she didn't violate policy by trying to reach for her taser. And you also heard that from the former police chief of the Brooklyn Center Police Department. This is a police chief that was forced to resigned in lieu of termination because after his review of the situation, his review of Kim Potter's body camera, he decided that she didn't act inappropriately. Listen to what he testified to on the stand yesterday.
When I viewed both camera angles and had all the data in front of me, I saw no violation.
No violation of what?
Of policy, procedure, or law.
And the policy and procedure at Brooklyn Center Police Department, to your knowledge, since you're the chief, followed the law of use of force. Is that right?
Yes, it does.
So is it your opinion that not only could a taser be used in this chaotic situation, but also a gun? Is that right?
That is correct.
Now, for both the former police chief and the defense's use of force expert, you heard during cross-examination the prosecution try to highlight that these are people who were sympathetic to Kim Potter, that they've had a long history in law enforcement. For the police chief, he and Kim Potter went to social events together and talked on the phone regularly. So they tried to suggest that these aren't impartial players in this process. But we also heard the defense bring up some character witnesses, and each of them talked about Potter during her tenure, her 26-year tenure in the police department, calling her a kind person, a patient person, someone who was a good trainer and who had a good reputation in this department. Remember, the defense's job is to poke holes in the prosecution's case, and they used some pretty big witnesses yesterday to try to do that.
And Shaq, just quickly before we let you go, what can we expect here in terms of a timeline? Are more witnesses expected to take the stand next week?
Well, the prosecution has wrapped up their case. We know the defense, they're likely to call 2 people today, according to some of the courtroom conversation. It is possible, based on those opening statements, that these are the final witnesses the defense will call, which means if there are no rebuttal witnesses, which we don't know for sure, this can be in closing arguments by Monday, and it's potential that the jury can have this in their hands by Monday afternoon. Again, that's me making a couple of assumptions based on courtroom conversations, but that's kind of the timeline that we're looking at this point.
All right, Shaq Brewster, thank you so much. Stay warm out there.
A search warrant has been issued for Alec Baldwin's cell phone nearly 2 months after that fatal shooting on the set of his movie Rust. This all comes just 2 weeks after Baldwin spoke publicly about the incident for the first time as the investigation ramps up. NBC News legal analyst Danny Savalos joins us now to explain what all this means. So, Danny, what more can you tell us about this warrant? What could it mean for the investigation and potentially for Alec Baldwin?
It's curious that this warrant application comes just about a week or so after Alec Baldwin sat down and gave an interview, thus suggesting that if you're a celebrity and you try to get out there ahead of the problem, that authorities are going to be watching very closely. And they may be looking to see if Alec Baldwin made any statements after the shooting as to whether or not he, in fact, pulled the trigger, because he denied it in an interview on TV. Other than that, this is an unintentional shooting. So they can't possibly be looking for text messages before the shooting where Alec Baldwin says something like, "Gee, I can't wait to shoot a live gun on set." That seems incredibly unlikely, but I guess anything's possible.
And Danny, we are hearing a response from Alec Baldwin, his attorney, on this, right?
Yeah, and I got to tell you, I would be mighty upset if I were Alec Baldwin's defense team. You have to understand that a search warrant is a complete invasion of privacy, but a search warrant of a cell phone is something the founders probably never anticipated. Our cell phones carry data and information about us that is almost as complete a picture of our inner thoughts as you could find. So the law is pretty clear that if a search warrant is valid, if they stumble upon anything bad about you, then that is fair game for prosecution. So I would be very concerned if I were the defense.
And I do believe we have a statement from Baldwin's attorney. If we have that, I do want to put it up just to give us a chance to react to the affidavit. It said, "We proactively requested that the authorities obtain a warrant so that they could take steps to protect Mr. Baldwin's family and personal information that is clearly unrelated to the investigation. A phone contains a person's entire life and personal information needs to be protected. While they evaluate the phone information, we hope that authorities continue to focus on how the live rounds got on the set in the first place." Now, Danny, there's still so much confusion about this shooting, mainly surrounding who was responsible. Alec Baldwin sat down for his first interview about the incident 2 weeks ago. Let's listen to some of what he said.
Well, I didn't pull the trigger.
So you never pulled the trigger?
No. I would never point a gun at anyone and pull a trigger at them, never.
Do you feel guilt?
No. I feel that there is, I feel that someone is responsible for what happened, and I can't say who that is, but I know it's not me.
So the big question, who was responsible? What are we hearing from the other people involved, like the film's assistant director and the armorer?
A lot of what you hear about them is even in the warrant application that we just saw. Of course, those folks have denied responsibility. The armorer has even said that she's never had a problem like this on set, and that in her belief, there were no live lethal rounds on set. But the warrant application does seem to suggest that folks beyond Alec Baldwin may have responsibility. I mean, after all, a warrant application is supposed to have probable cause that contraband or criminal activity evidence will be found in the place to be searched. And in this case, that place to be searched is the vast data trove in Alec Baldwin's cell phone.
Now, Danny, of course, there were 2 victims in this shooting. The film's director, Joel Souza, was wounded, and the cinematographer, Helena Hutchins, was killed. What kind of legal action could Joel or Helena's family take? And do we know if they've even done anything like that yet?
There are absolutely options for civil liability. And while there may, and I stress, may be some workers' compensation bar, I doubt that's the case. These were probably all independent contractors to some degree. And so you're going to have so many different layers of companies that were there and so many different layers of insurance. Even though this was a low budget, or it's been described as a low budget film, there almost surely were many layers of insurance and many different levels of negligence, arguably spread out among many different people.
All right, Danny, thanks so much for your analysis. We appreciate it.
All right, it's of course been a week of extreme weather. Let's get a check on where that's at with our Morning News Now weather forecast.
Hey there, Bill.
Hey, good morning. So I have a more typical forecast. I got a little snow to talk about, some rain, and some colder temperatures. So, yeah, finally it's returning a little bit to normal. But I'll start with telling you, New York City set a record high this morning at 5 a.m. of 59 degrees at LaGuardia Airport. So there's still a lot of unusually warm air that is beginning to head out. So the big story today, we're going to have some bad weather returning to those areas that a week ago had those horrific tornadoes in Arkansas, Tennessee, and especially Kentucky. This is not going to be a storm like that one, but we are going to have isolated severe weather. We're going to have some rain. So it's kind of the first bad weather they've had since the tornado struck. So obviously it's not going to help with cleanup efforts, but it can't be clear and nice forever. So, a few strong storms this evening. I'm mostly talking about areas of Oklahoma, possibly North Texas, into areas right around the northwestern corner of Arkansas. And then on Saturday, that rain moves right through the state of Kentucky. And that blue on the map shows you some snow on Saturday in northern New England and a little bit of icy weather there from the Catskills to central Mass and areas of Hartford. By Sunday, everything kind of clears out. So as far as severe weather goes, this will be isolated severe weather, maybe some hail, some damaging wind. The chances of any tornadoes are very low, but not impossible. So from Sherman, Texas, northward to Ardmore, heading up almost towards Fayetteville, Arkansas. And because of the heavy rain threat, we do have a flash flood watch from McAllister up to Fayetteville. We could get some quick stream rises. That area could get about 1 to 2 inches of rain. But again, I'm not expecting any huge issues. So for Saturday's forecast, there's that snow, sleet, freezing rain, all possible in areas of New England. And as far as snow amounts go, not a huge blockbuster event, guys, but I'm sure the skiers and snowmobilers will take whatever they can get because they haven't had much, about 2 to 6 inches there in northern New England. But for the big cities, you're going to have to wait. And we'll talk more about that next hour. I'm going to go out on a limb and take a look at next week's forecast leading up to Christmas.
Ooh, a Christmas forecast. Then maybe New Year's, too.
Danger.
All right.
Thank you, Bill.
Thanks, Bill.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.